Hello, I am Dr. Corey Yurokis, and I'm a veterinary clinical pathologist with Zoetis's digital cytology team, and I am on the other side of your imagist reading your cytology samples. This series of videos is tips and tricks for improving your cytology and hematology samples. And today's episode, we're going to be talking about cytology storage, so storage of our samples, and some staining tips. So for cytology sample storage, once the sample is on the slide and it's spread out, we don't need to do anything with it. You actually don't even need to stain it right away. What we don't want to do is we don't want to put it back in the refrigerator. We don't want to put it back in the freezer. Stain it when you get to it. Let it dry completely, which is really nice, but we don't need to be putting the slides back into the refrigerator or the freezer. If you do store your slides in the refrigerator, just make sure they warm to room temperature before you use them. The biggest thing that we actually see, which I didn't really think about in practice either, I didn't learn this till I went back to residency, is that formalin can actually cross-link all of the cellular proteins in a cytology sample. And then the only thing we see is this hideous, horrible, understained blue tint to everything. And the slide is completely unusable. And this can happen even with exposure to the fumes. So if you are in surgery and you want to take a cytology or do an impression smear of a biopsy sample, and then you're also going to send that out for histology, make sure that you're doing those preparations in completely different areas. Have the formalin jar in the whole other end of the clinic, somewhere far, far away from where your cytology samples are. Even cytology samples riding in the same box as formalin fixed samples to the lab can result in this cross-linking. So you always want to make sure that you are packaging your cytology separately from any of your biopsy samples to avoid that. Even a box that has been used, if you have plastic boxes, even if the box that has been used to ship biopsies before, even the residual formalin can lead to cross-linking. So make sure you keep everything absolutely, absolutely separate. For fluids, we have a little bit more of leeway in storage options for fluids. Anytime you're collecting a fluid and either you're in the field or you're making a house call or you're not going to be able to get back to the hospital and get that sample prepped right away, what you want to make sure that you do is at the very least make a direct smear of that sample. That way it captures in real time what that sample looks like. It's capturing cell morphology, it's capturing protein background, any sort of changes that are happening in that fluid the minute that you took it out from the animal. So that's a real-time snapshot. So make sure you're making your direct smear. Again, you don't have to stain it right away, but we just have to get those those cells captured onto the slide. In terms of storing the fluids, put a sample in EDTA, and that's going to help maintain cell morphology because the instant those cells are out of the body, they're going to undergo changes. So if we put them in EDTA, we're going to start preserving more of that morphology. We can actually start to see changes in as little as 2 hours and remarkable changes up at 24 hours. So if this is a sample that has been stored in any way, shape, or form, you want to make sure that you're putting that on your submission form so that the pathologist knows that, hey, this sample did sit for a little while, or this is how I stored it, so that we don't overinterpret any changes that are there. You want to always make sure you have a sterile tube if you think you're going to need culture. This is usually one without any additive in it, no serum separator, anything. This is going to be just a plain sterile culture tube. Fluids can be refrigerated. And again, like I said, usually up to about 24 hours is going to be fine to still interpret that fluid. Anything longer than that, though, we're probably going to need a sample. But if we're going to resample, but these fluids, they can sit in the refrigerator or in a cooler if you need to. Sample staining. I think this is one where it's so variable and every person stains a little bit differently. Some people will leave the slide soak in the stain. Some are dippers. I myself am a dipper. So I like to dip into each solution, but I do have colleagues and friends who will leave the slide sitting in the stain for the recommended amount of time. No matter which way you do it, as long as you are getting slides that are stained and stained well, doesn't matter if you're a dipper, it doesn't matter if you're a soaker. How long? Everybody always asks me how long. That's the most common question. And honestly, refer back to whatever the manufacturer tells you. Usually it's about 15 to 30 seconds in each solution, but again, it depends on the manufacturer. They know their stain the best. So refer back to the package insert in terms of how long to expose the slide. We talked, I think, in a previous video about having two sets of stain. One is a clean stain for cytology samples, hematology samples, and a dirty stain. And these are going to be your ears and rears. So your ear cytology samples and any fecal, so anything that's going to have bacteria in it from a dirty part of the body is going to need its own set of stain. In terms of changing out the stain, most manufacturers recommend every 2 weeks. Some manufacturers recommend 1 week. Good rule of thumb is if you are a cytology, hematology frequent flyer and you're doing, 50 plus cytologies a day, you're going to be needing to change out your stain more frequently. And the reason is, one, we can get debris built up and we don't want any stain precipitate in the background. Another two, the stains do get worn out. The stain loses its power. It can get diluted from going from one solution to another, which isn't wrong, but it's just something that happens with increased use. So if you are doing a lot of cytology samples, a lot of hematology staining, you're going to want to be sure that you're switching out your stain regularly. To figure out whether your stain is good to go, you can always pop it under the microscope yourself. If you don't want to do that or don't have time, I would always take my slide and hold it up to either the pink solution or the blue solution or purple, whichever you want to call it, and see if my slide was matching either one. If your stain is actually matching either stain, we've either gone too light or we've gone too dark. What we want is a really nice lavender that's kind of in the middle between the two pink and purple stain solutions. So let's look at some examples because that's kind of hard just to hear in words. So this is a stain that's too dark. If we notice that everything is purple, and it's kind of like starry night, but not really. The background of the stain is going to match that purple stain. I can't see cellular detail. There are cells there, but I can't see the detail. I can't see the nuclear features. Everything is just too dark. This is kind of the other end of the spectrum. I see my red cells quite prominently, but what I also see, there's nucleated cells in the background, but I can't see who they are because they're understained. So this one, we may have even skipped the purple or gone really light on that third solution and just went just really understained. What we're actually looking for is this, a really nice contrast between the red cells and the nucleated cells. The red cells, we want kind of a nice pinky orange, and any of the nucleated cells, you want to make sure that the nucleus is purple. And even if you don't know what you're looking at, you're not looking to diagnose the tumor, that's fine. That's what I'm there for, to take that stress off your shoulders. What you can look at under the microscope is, can you see a difference in color between the red cells and any other nucleated cell that's there? And if the answer is yes, then your staining is probably good to go. For submitting your samples, and this is probably almost just as important as spreading out your sample well and staining your sample well, is the information you give when you submit that sample. It's almost, I wouldn't want to walk in with a dog and then just hand it to you and say, vomiting. You have follow-up questions, and I have follow-up questions for you too. What sample did you give me? Where did it come from? How big is it? How long has it been there? Is it ulcerated? Does it bother the dog? Is it painful? Is it growing? Has it shrunk? Does the size change? Any of that information is going to give me even more and more clues to unlock what's going on your slide. So you can really never tell me too much information about that lesion. Anything that you can tell me is fantastic. The more you can tell me, the more definitive I can be for you, and especially for those cytology samples. For hematology samples, the most crucial piece of information we get there, yes, patient history is very important, but so is that CBC data. That CBC data is so important. Even for the AI review, the AI is going to give me a snapshot of what it captured on the blood smear, but it's not going to give me the cell counts, and it's not going to give me the hematocrit counts, and it's not going to give me the red cell index and things like that, that I really need from your CBC data. So the CBC, the AI review, the blood smear is kind of like a triple package. It all goes together. It all complements each other. I can use the AI review and the blood smear to identify discrepancies in the CBC data. And I can use the CBC data to kind of figure out, where those discrepancies might be. It gives me more information about what's going on in the red cell line. I can tell you what kind of anemia it's going to be. The last thing I want to do is guess and give you an incomplete report. So for those blood smears, that is so, so important. So in this video, we reviewed, some staining tips, some staining pitfalls, how to troubleshoot your stain, and the absolute importance of so much information when you submit your samples. Hopefully you got some good tips that you can take back to your practice today, and thank you so much for listening.